Hello. Today we're talking about hypertension, also known as high blood pressure.
Hey there, I'm the sneaky guy who can cause trouble without you even noticing. If your blood pressure is consistently above 140/90ths mmHg, I'm hanging around.
That's right. Hypertension is usually asymptomatic, meaning most people don't feel any different. But just because you don't feel it doesn't mean it's not dangerous. So get your blood pressure checked regularly, especially if you're over 40. Let's dive into why some people develop hypertension, also known as high blood pressure. Hypertension, care to explain?
Sure thing. First off, if high blood pressure runs in your family, you might be next. It's in the genes. And don't forget about salt. A high sodium diet is like an invitation for me to stick around.
That's right. Obesity also plays a role. Being overweight increases your blood pressure. Stress is another factor. Acute pain or stress can temporarily elevate your blood pressure. Now, let's talk about secondary hypertension, which is caused by other conditions. Pregnancy, alcohol consumption, and certain renal diseases can all lead to high blood pressure. Additionally, coarctation of the aorta, a narrowing of the aorta, is a key factor. Endocrine diseases like Conn's disease, Cushing's disease, acromegaly, and hyperparathyroidism can also trigger secondary hypertension. Lastly, some medications, like combined oral contraceptives, NSAIDs, steroids, and sympathomimetics, can cause an increase in blood pressure.
When these conditions or medications are present, they give me the perfect environment to thrive, making it harder for your blood pressure to stay in check.
Let's look at who's more at risk for hypertension. As people age, their blood pressure tends to increase, making hypertension more common in the elderly.
Exactly. As you get older, or if you're part of certain ethnic groups, I'm more likely to be part of your life. So, it's crucial to keep an eye on those numbers.
So, you've met hypertension, but how do you know if he's causing problems? Let's talk about monitoring and investigations.
You can't catch me that easily.
Actually, we can. A validated blood pressure monitor is the key. If your first reading is above 140/90ths mmHg, we take another reading at the end of your appointment. If readings stay high, we do further tests like urinalysis, glucose, electrolytes, and even an ECG. Regular monitoring is crucial, especially if you're at risk.
Checking both arms and keeping up with appointments are all ways to keep me in check. Don't let me sneak up on you.
How to keep hypertension under control with some simple lifestyle changes.
Oh no, not the lifestyle talk. That's my weakness.
Diet. Eating healthy, well-balanced meals with lots of fruits and vegetables and cutting back on caffeine can help lower blood pressure. Quitting smoking is also crucial steps. Make these changes today, and you'll be on your way to a healthier heart. There are 5 main classes of drugs that help keep hypertension in check. Let's break them down. First up, ACE inhibitors. They block a chemical that narrows blood vessels, helping them relax. Next, calcium channel blockers, which reduce resistance in your blood vessels. Then there are thiazide diuretics, which reduce the volume of blood, making it easier for the heart to pump. Beta blockers and alpha blockers are also in the mix, reducing heart workload and resistance. Talk to your doctor about the best option for you.
Really trying to track me down.
Today, let's talk about ACE inhibitors. These drugs, like captopril, enalapril, and ramipril, block the conversion of angiotensin I to angiotensin II, a potent vasoconstrictor. This results in vasodilation, which lowers your blood pressure. But be cautious. ACE inhibitors can cause a rapid fall in blood pressure, especially in patients taking diuretics due to volume depletion. And watch out for that persistent dry cough. It's a common side effect due to the inhibition of bradykinin breakdown.
ACE inhibitors make it tough for me to tighten those blood vessels. But beware of that pesky cough.
Next up, calcium channel blockers like amlodipine, diltiazem, verapamil, and nifedipine. These drugs block slow calcium channels in peripheral blood vessels and the heart, reducing peripheral resistance. There are 2 types: dihydropyridines, which relax vascular smooth muscle, and negative inotropes like verapamil and diltiazem, which reduce cardiac output and slow heart rate. Common side effects include hypotension, facial flushing, and edema.
These blockers make it really hard for me to squeeze those blood vessels tight. But hey, they might cause some swelling and flushing.
Let's discuss thiazide diuretics, like bendroflumethiazide. These diuretics reduce circulating blood volume, making it easier for the heart to pump and lowering blood pressure. They're well tolerated at low doses, but can cause side effects like postural hypotension, hypokalemia, and even gout. Monitoring blood glucose levels is crucial, especially in diabetic patients.
Thiazide diuretics drain away my power. But watch out for those electrolyte imbalances. They can sneak up on you.
Now, let's talk about beta blockers, such as propranolol and atenolol. These drugs reduce cardiac output, which lowers blood pressure. However, they are less commonly used now due to their decreased effectiveness in preventing stroke and cardiac events. Beta blockers can cause side effects like bradycardia, cold extremities, and vivid dreams. They're especially risky for asthmatics, as they can cause bronchospasm.
Beta blockers slow down the heart, making it harder for me to keep the pressure up. But don't forget, they can cause some chilly hands and feet. Alpha blockers make my job really tough by relaxing blood vessels, but that first dose can be a doozy, so take it slow.
Lastly, alpha blockers like doxazosin and phentolamine. These drugs reduce total peripheral resistance, leading to lower blood pressure. But caution is needed, especially with the first dose, as it can cause profound postural hypotension. Side effects to monitor include dizziness, fatigue, and gastrointestinal disturbances.
Alpha blockers make my job really tough by relaxing blood vessels, but that first dose can be a doozy, so take it slow.
To help you remember the main drug classes for treating hypertension, think of the acronym ABCD. A is for ACE inhibitors, like enalapril, and for alpha blockers, like doxazosin. B stands for beta blockers, like atenolol and propranolol. C is for calcium channel blockers, like amlodipine and nifedipine. And D is for diuretics, specifically thiazide diuretics like bendroflumethiazide.
Just remember, ABCD. It's your go-to guide for hypertension management.